Hi, everyone. Welcome to tonight's conversation. I'll be speaking to Bex Logan, who's connecting to us from Northern Ireland. And yeah, welcome, Bex. Thanks for joining us on the channel.
Thanks for having me. It's great to connect with you.
Cool. Yeah, it's lovely to connect with fellow long haulers around the world. Just to start off, I'd love you to introduce yourself, tell us a bit about yourself, what you were doing prior to your COVID-19 infection, and yeah, how was your health and life before battling this disease? Yeah.
Yeah. Well, I'm Bex. I am now 43. I've been a nurse for over 20 years. Most of the time spent in my local hospital emergency department. And in 2017, I've always had a love of dance and fitness and exercise. So I actually started to seriously go down the fitness path, and I became a fitness instructor in 2018 and also a Les Mills body combat instructor. So I was super fit. Worked the two jobs that I loved. Did night shifts in hospital, then would have continued to not going to bed and taught to class, and then maybe going to bed for a few hours. So I was constantly on the go. I'm also a mum to two girls, and they're now 17 and 14. And I am married to Gus. And yeah, I was just fully involved, mum and wife, constantly doing things with the girls, taking them to things. And also, I was quite very sociable, always out, loved to dance, loved to party. Was the last one to leave. So yes, I was just my health was also very good. When I started the fitness, I lost a lot of weight and then just continued to be on a really healthy diet. I was never off sick. I was always active and fit and healthy. So I had no underlying health conditions. Over the years, I did have parvovirus, which is what dogs animals can get. So I was quite unusual in that I got that when my youngest daughter got slap cheek, like a bit like scarlet fever. So I got parvovirus, which was the adult version. And I managed to get parvovirus 3 times, which the consultants found that very fascinating because it's quite unusual. So that was the only thing in my medical history prior to COVID that kind of would have affected me in my sort of working life, I suppose. So, but I mean, I always recovered and I was always able to get back to, fitness and health. So life was great. I was the fittest and happiest and healthiest I'd ever been. Yeah.
Mm. Now tell me so you said parvovirus.
Parvovirus, yes.
I've never heard of it. So I guess would you say that sort of affected your immune system to some extent prior to COVID?
Yeah.
Or okay.
Yeah, I mean, it probably could have, or it could have given an idea of how my body would respond to viruses. However, now I haven't really had, I mean, I've mentioned that a number of times to different consultants and medical professionals I've seen, and they have no answers to that. They say possibly, but they can't say either way, because I suppose at the time, the bloods that I had done when I had parvovirus were proving that I had parvovirus, but they didn't say, I didn't have much follow up in that, you have, probably a predisposition to other viral illnesses or anything. It wasn't ever, it was just unusual that I had it more than once, because the consultant that I saw said that he could count in one hand in his 30 years of practicing the amount of patients he had that had parvovirus more than once, and I was one of them. I also was diagnosed at that stage with hypermobility syndrome. But again, I didn't think anything of it, because I thought, well, that's something I don't have to deal with yet. It might happen later in life, but, it's not going to have anything major in my life in the near future. So those are the only things that possibly could have contributed to how I am now. However, at the time, I wasn't told anything, that it was something to worry about.
Sure. Now take me through. So you're working in the hospital, I guess part-time, right? You're not full-time there because you're doing the training stuff as well.
Yeah, I was part-time, yeah.
Now, was it part of your, I guess, contract that you had to have a vaccination to work in hospitals? Was that part of the protocol?
What do you mean by a COVID vaccine? I was where I got COVID in 2020, so there were no vaccines.
Wow. Okay. So you are you still unvaccinated to this day?
No, I did get vaccinated whenever the vaccine was available, but I caught COVID in the first wave. So I got it on my positive test was the 7th of April 2020. So vaccines weren't there.
Wow. So one of the first ones, I guess. I mean,
Yeah.
I only got it for the first time March 2022. So it shows you a timeline of how we all living in this fear bubble down in South Africa, thinking, okay, hopefully it won't reach us. But this particular virus is incredibly good at jumping, I guess, and just spreading. Talk me through your infection. So in April 2020, you've now got the virus for the first time. Vaccines aren't available yet. What was your experience of the virus, and what were your, I guess, long-term symptoms post that? And at what point did you know that actually I'm not better, like my body's being affected?
Yeah, initially, I didn't really have the typical symptoms that we were being told about from the government, like to isolate, because I actually went into work on the on the morning before then. I realized I wasn't well. I felt really delirious. I felt just really strange. I didn't have a cough. I didn't have breathlessness at that stage. But I just knew I didn't feel right. And obviously, because I'd been working in COVID emergency department for weeks before this, not properly protected with PPE, I was like, well, it must be COVID. So I was sent home from the shift. And then I was swabbed that afternoon. And then by the time I got my result 2 days later, I'd lost my taste and smell. But for me, the first 10, 12 days, I felt flu-like. I just felt unwell, like a bad flu, but I wasn't seriously unwell until about day 13. I started to get very breathless, and it was almost like the opposite to what had been happening to other people who had it. Initially, the first 5-6 days, they were really unwell, and then as time progressed, they felt better and were able to return to work after 14 days. Whereas by day 14, I literally couldn't speak a short conversation without like really gasping for breath, and I felt worse. I felt more fatigued. I felt more lethargic. I just felt unwell. And at that point, I had to go to my emergency department. They didn't admit me. I mean, that in itself was quite traumatic because I obviously was saying bye to my girls at home, not knowing whether I'd come home. And I think as well, because I was a nurse who had nursed in COVID and had seen the horror of what happened to people, I was absolutely terrified because I didn't know what was ahead of me. But thankfully, I was borderline for admission, and because I lived so close to the hospital and I was a nurse myself, they said, look, we'll allow you to go home after the day. So I came home, I rested, the breathlessness continued, and then I had to go back to A&E. We're now talking 5 weeks post-initial infection, and the doctors were a bit flummoxed because they said, we haven't come across anyone like you who sort of has continued to be unwell. They thought I had a pulmonary embolism in my lung because of the breathlessness, but the scan was clear. And
what is an embolism? Is that a
the pulmonary embolism is a clot in the lung. So they they just said I needed to rest, because I suppose, like we were all told, when you're effectively, we were told we should be better after 2 weeks. And I thought, well, why am I not better? I'll try to exercise. I'll try to walk a bit. But the doctors were like, no, you need to rest. There's some, you just need to complete rest for another while. So that was the start of May for, yeah, like 4 years ago now. And I have never returned to
That's
work.
a long time.
Never
Yeah.
returned to work, never returned to nursing.
Wow.
I've now lost my nursing registration. Physically, the summer of 2020, I started to feel about 70% back to normal, but cognitively, I was not, and it wasn't safe to work as a nurse. But I did try to start taking classes again, fitness classes, because also at that time, no one had heard of long COVID, and my GP, who I spoke to for help, said I was depressed. You've all heard that, they like to psychologize these
Oh
conditions.
no.
Yeah,
Yeah.
so I was
Oh.
told by my GP at the time, and also by the staff COVID helpline for mental health, that I just needed to get back into routine and to wise up. So I was getting that advice, and I
Mm.
knew I was physically unwell. It was like, what the heck is wrong with me? So I started the classes. Then after 4 weeks of doing maybe teaching 4 classes a week, I got a urinary infection, and I was noticing my lips were turning blue. I just really was struggling to get through a class, but that would have been really easy for me before COVID. Had to reduce classes. I was getting no help from my GP. Nobody knew what was going on. People were saying, I've never heard anyone like you. The whole, you nearly are being questioned. It's like, I couldn't understand, and still can't understand, why people were questioning why I wasn't better, whenever the person I was before was the opposite to how I was and am now. It was so frustrating. And for me, then, that probably the Christmas of 2020, the fatigue was horrific for me. I just could not get a break. Pain had increased. I've had tinnitus for over 4 years. Brain fog, cognitive dysfunction, chest pain, like fast heart rate, joint pain, muscle tremors. Like, the list goes on. And actually, now the point I am at today is the worst I've been ever in the whole time. I'm now unable to walk. I use a wheelchair. I manage, if I'm lucky, to be out of my bed for 2 hours a day. And I'm struggling to be able to have a shower every day now. I can't wash my hair. And it's the symptoms that I had, I suppose, initially, are just all worse. And I don't know why, because I've tried so much, which I'll talk about in a wee while. It's not as if I've just sat here and felt sorry for myself and just, thought this, I've been proactive in trying to get better, because as I've said, the person I was before this is the polar opposite to the person I am now.
Yeah, I totally hear you. I feel the same in a lot of ways. I wanted to ask Bex, at what point, what was the timeline towards the vaccinations? Was that end of 2021?
I can't.
When you got the vaccines, did you feel like what was the reason you wanted to get it if you'd already had the infection? Did you feel like it would help alleviate some symptoms?
It didn't. No, I didn't think it would. I just thought it was probably safer to get it than to be reinfected. For me,
Okay.
that's why I chose to do it. So it wasn't. I can't remember. I don't know. I can't remember when the vaccine was. I think the UK was the first place to rule out the vaccine, rule it out. But it could have been. It could have been like December, January 2020. I can't remember. I honestly can't remember. But I know that I only had the.
Tell you what, yeah.
I don't
So
know.
I know the brain fog is a horrible thing. I totally understand. My short-term memory is incredibly bad.
Yes,
I will take a vitamin or a medication that I'm on, and 5-10 minutes later, I have no recollection if I took it or
I'm
not.
exactly the same. But
And I've had days
ask me
where,
something.
yeah,
Yeah, ask me something from 30 years ago, and I can tell you.
yeah,
Ask me something for 30 minutes ago, I don't have a clue. But I know I had. You see, I then went to Germany to have the health apheresis. I had health
yes.
apheresis.
I've heard of yes.
So I had to get I I had to get my vaccines to be able to travel, and I went there in January 2022. But I definitely had the the initial COVID vaccine and the booster by the time I went, because we had to show the certificate to travel. But
Yeah, yeah.
The first COVID infection really flattened me, but I expected that. But it didn't affect me. It didn't make me worse or better. Do you know what I mean?
So the vaccines didn't make you worse or better, is what you felt. Yeah, yeah.
Yeah.
You can send me the dates when you find them at some point. I'll put them in the description below the video so people
Sure.
can see the timeline. I think it's super interesting. I've heard a lot of people who will say to me, Chris, like, oh, it's probably the jab, it's probably the vaccines that you got. That's why you're dealing with all these symptoms. And in my case, it definitely could be related to the vaccines. But the problem is for me, because I had 2 Pfizers and then 4 months later I got the acute infection. Right now, where I am at now, I wasn't experiencing like huge fatigue and body aches and all these things straight away. It's like once I got better from COVID, it was a slow, almost like
Yeah.
this downhill slope. So it's almost like by the time you realize, oh my word, there's something actually wrong with my body, I'm unable to say it was definitely the vaccine, definitely
Yeah.
the acute infection, or a combination of both. It's very difficult for me to tell. But yeah, I've also had people just like immediately blame it on the vaccine as
I
if that's
know.
the definite cause, whereas the COVID virus is doing so much damage. Yeah, and I think you're a pretty good case of you struggling so much just from the infection before the vaccines were even
Yeah.
available. Yeah, but
I
tell
mean,
me more about the. Sorry, take it. Yeah, you go.
no, they do say that the first waivers, really are the ones that aren't recovering. There's more people
Mhm.
like, just especially that worked in the health professional. Well, in the UK anyway, I'm not sure about worldwide, but I just know that, yeah, the viral load that we got was the initial infection, and it was massive. So yeah.
It's almost like if I think I probably had a different strain to what you had in
Yes.
2020, what I got in 2022. They wouldn't tell me the strain. I asked about it when I got my blood results back, or the PCR test, but they're like, no, we can't tell you the strain of what it was. I don't know if that matters, but yeah, it still did some damage to my body, I will tell you. Sorry, the plasters I've actually got on is I'm on the anticoagulants, the triple therapy at the
Oh,
moment.
right.
So
Okay. Yeah.
every time I nick myself or anything, it's just
Oh no.
blood and it doesn't stop. So I have to keep myself well bandaged up. But
Yes.
sorry, I wanted to touch on the you said health. Is it health or help? Apheresis.
HELP.
HELP,
Apheresis.
help apheresis.
Help.
Okay, talk
Yes.
to me
Help.
about that. Yeah, I've seen a few people flying to Germany to do that treatment. Just explain a bit to the viewers about
Yeah.
that, what it does. Yeah.
Well, yeah. It's basically they drain out your blood from one arm, and then they pop it through the apheresis machine, and they heparinize your blood, and then you get it put back in the other arm. And it takes about 4 hours to do. I went over because I was speaking on the radio, and Dr. Yeager and Assad Khan were on the radio as well, and they had they were quite, it was really exciting and new, this discovery that microclots could be the cause of long COVID. So they invited me over to Germany, and I went for 5 weeks in the January of 2022. It was grueling. It's a very, very intense treatment, and I think not because women are weaker or anything, but I do think that it takes more out of women, because just for a number of reasons, there weren't very many women there when I was there. When Dr. Yeager met me, she said that I was one of the most severe patients she had seen with long COVID. And I think, did I have 5 or 6 treatments? And then when I was getting the apheresis, I was also on triple therapy like you're on at the minute. I was on aspirin, apixaban, and clopidogrel. So, yeah, it didn't help me. It probably made me worse. My body was just too weak, I think, and I came home, and 2 days later, I was in hospital with pneumonia, and I was very unwell. They did do my slides, the way you see the slides now which show the microclots and stuff. I didn't have a lot of evidence of lots of microclots, but I did have Dr. Yeager phone me when she saw the results, and she was like, I've never seen platelets like yours. My platelets were extremely hyperactive. But yeah, it was, I mean, I had to try it. I had to, because there's still nothing like that being offered in the UK. And our health system is very different to European and your own, that we're quite restricted in what we can have access to, and even to come home to continue to be prescribed the triple anticoagulant therapy is virtually impossible, because there's no policy, there's no evidence as such. Do you know what I mean? I think, yeah, so I had to try it. I wouldn't do it again, and I would really strongly, if people ask me would I recommend it, I think it helps for some people. I think for a very severe person, I don't think it would. I think there's minimal effect. But again, I think because long COVID is such an individual disease and how it affects individuals, one treatment could work for you, but it won't work for me. But that's the problem with it, because there's so many areas to it and so many different ways it can affect people. So, and I never really had like chest issues as such, or breathing issues. Once the initial breath, I always have breathlessness, but my lungs are okay. They're damaged now because of pneumonia that I had, not because of COVID, quite ironically. But yeah, it was quite an experience. It's quite traumatic.
Yeah. So sorry, tell me, you picked up pneumonia after getting back from the HELP apheresis treatment in Germany. Is that correct?
That's right. Yes, 2 days. I flew home on the Sunday and was admitted on the Tuesday.
Do you think? Well, my doctor has mentioned that being on the blood thinners does affect your immune system somewhat. Do you think the HELP apheresis also does that? And sorry, I've got a mosquito buzzing. I'm like watching it. Like, no, please don't land on me. My blood's already like enough issues. Stay away. But so does the apheresis also affect your immune system? Yeah.
I don't know for sure, to be honest, Chris, but I do know that my body was very vulnerable, and I was wearing a mask traveling. So I think my body, as I said to you, even before I started the first session of apheresis, my body was depleted. And then every session I was getting more and more depleted. And then the traveling home and whatever, I don't know. Again, because the doctors here hadn't heard anything about help apheresis, they weren't saying, well, they didn't know anything about it to be able to say the pneumonia was caused by such and such. Do you know what I mean? But I do think I was in a very vulnerable place in my health at that point, and that's probably contributed to the pneumonia.
Wow. I was going to touch on the point that you made about the disease is quite different for everyone, and that's something that boggles my mind. Is I've heard people say there's over 200 different symptoms relating to long COVID, and I guess there's other people with vaccine injuries who have different symptoms to that, and it's that's what's tough for me, is like trying to find a treatment that'll work for everyone, where we have different blood types, we have different diets, I guess. Our gut health will be different. Our immune system, just genetically how we made from our parents is different. And it's an incredible, well, I'd say a very challenging journey and topic to figure out what works for you. But just on the triple therapy, are you sorry? Are you still on those
No.
3 anticoagulants? Okay.
No, I stopped that because it wasn't helping me in any way. And to be honest, well, I couldn't get it prescribed here anyway. So once I finished, whenever Dr. Yeager saw my platelets, I had to stop the clopidogrel. And I think she also agreed that it wasn't really going to benefit me being on it. So I stopped it, and haven't been, no, I don't even take aspirin anymore, because
Wow. But it's interesting to me that you say you weren't noticing prevalence of microclots, but your platelets are hyperactivated. In my case, I've got a bit of, well, actually quite a lot now of hyperactivation, but also I had a lot of the microclots. I can send you the photos of the slides that I got. But yeah, I've been on this triple therapy for, I think, 8.5 months now.
Right.
And it's definitely a tough journey. I relate to you a lot of just, I think the pain is, as the clots are breaking up, I felt a lot of aches, and I still have body aches to this day, like 2 years post-infection.
I
didn't have body aches. I didn't have I was going to say the body aches I didn't actually experience until post-COVID. I'd say the acute infection. After the vaccine, I was having a bit of fatigue after the second one. The first one I was fine. Second one, I started getting like I needed to go take a 2-hour nap here and there, and I'm that's, like I said, it's difficult for me because at the time I didn't know about these blood draws that you can do to check for microclotting, and I wish I had done a blood draw after my 2 vaccines just to see, did something change, like. But again, it was very unknown at that stage, like you say, with long COVID wasn't known. So talk to me a bit, Bex, about what supplements or what are you doing right now to get through day by day?
Well, I've had to pay privately to see people, because in Northern Ireland, the long COVID clinic that was provided by the government that I only managed to see in like April 2022 virtually. They, after an appointment, they discharged me because I was too ill to treat. And I was like, pardon? I'm a nurse. I've never discharged someone from any type of hospital, even if they're dying, because they're too ill to treat. But I was discharged because I was too ill to treat. Basically, I was too ill to fit the category of their referrals, of what they were offering, the services they were providing. I was too ill to be able to attend. So I've had to do a lot of self-management and try and, go about things myself and go privately. Being a nurse and having worked in the same hospital for about 20 years has been beneficial because I've been able to have contacts with different consultants. But I developed chronic spontaneous urticaria whenever I was in Germany. I had like an all over rash, the itch. I can't describe how crazy the itch is. I wouldn't even say it was a rash. It was like coming from inside, like a burning sensation under the skin,
Yes.
and then the itch. it wasn't like a bite where you can see it and scratch it. So whenever I came home, I was referred to immunology, and that's where I was diagnosed with chronic spontaneous urticaria. So I've been treated by them. I'm on high dose antihistamines. I take those 4 times a day, and I also take Reputidine. Don't ask me what exactly it's for, but I know that it also helps the platelets.
Yeah, I've never heard of it, but okay.
And I also take Montelukast, which is generally an asthmatic drug, but it can also help with the urticaria. So I take those. Then the medical consultant that I had been seeing retired, and I got a letter to say that I was just being discharged rather than being referred to anyone else, his replacement, which is the story of most long COVID patients in Northern Ireland. I don't know about yourself, but there is just a lack of knowledge, a lack of wanting to know how to treat people with long COVID. So then in February of this year, a friend of mine who had seen this particular doctor, a rheumatologist, she told me about her, and she said it would be worth your while trying it because she had long COVID and she had also seen this doctor. So I went to see her privately, and she recommended I do an elimination diet to reduce the inflammation in my body. And also, again, we mentioned earlier about gut health, and I do think the virus has completely wiped out our gut health. So I did, and she also suggested a test. Now it cost over £300 to do, and I had to fund that myself. Like the amount of money I've spent in the last 4 years on trying to get help is like tens of thousands of pounds. It's awful, and I had to borrow from family and that sort of thing. So I did this test, and I honestly have to say that it's the best. It's the most useful test that I've had done in 4 years, and it was a urine sample, would you believe? And it basically showed that my body isn't repairing itself. It's not repairing DNA. It's not repairing other cells. It's not function. The mitochondrial function is dreadful. My body isn't breaking down carbs properly. It's just not working. So from that, I've done the elimination diet. So I cut out carbohydrates, refined sugars and gluten. Now my head's starting to go. Yeah, they're coming to 40 minutes.
That's okay. Don't worry.
So I cut those out. I increased the protein. And then from the results, I now take like a basket full of supplements. I take omega oils. Omega oils. I take magnesium. I take glycine. I take a multivitamin. Like I was basically deficient in. I can send you just a copy of the results. It's really fascinating. I'm deficient in all B vitamins.
Wow.
I am taking what else? Probiotics, digestive enzymes. Yeah, a whole lot of stuff. Iron. But yeah, so I don't feel that the fatigue is horrendous since January, and the diet and the supplements haven't helped that. But I feel less bloated. I feel my sleep has improved because my sleep was dreadful. But I basically wasn't producing any serotonin. My mood had been is really low as a result of my physical health. But she said it's no wonder because your body's not producing any happy hormones. So
yeah. Tell me, sorry, yeah.
Yeah, go
Sorry,
ahead.
to the viewers, we have a bit of a lag between Belfast and Stellenbosch, so bear with us. I was going to ask, had you had an experience of mental health prior to COVID? And
I had
COVID?
I've had postnatal depression, and I've had episodes of depression. throughout since my first child was born. So I have, but I think I'm very aware of my mental health. I look after it, and the problem was, especially in the early days of before the World Health Organization recognized that long COVID was a condition, and I was trying to get help from the GP that I was at the time, and being told I was depressed. I knew I wasn't depressed because I had been depressed before, and I knew.
No, you know it. You know what it feels like. Yeah.
Definitely do. And
Mm.
then I felt that because I had a history of depression, that was an easy answer for them. And you're nearly afraid to say, to a doctor when they say, have you any history of depression? When you're like this, it's like, yes, but it's not the same. You're nearly afraid to admit it in case they think, oh well, this is just part of her depression. And it's definitely not. There's been times during these 4 years, most of the time I'm not depressed. It's a result. Your mood is a result of your physical health. Do you know what I mean? Like, and how could anyone not be low living like the way we do every day? But
I fully agree with you. Yeah, I actually. So I wanted to touch on that point. I also had experiences of depression. So when I started hearing about people that have long COVID suddenly needing to go to psychiatrists and go on antidepressants after no mental health issues whatsoever their whole life, I'm like, wow, it's quite a serious thing. And I do get it. I think what maybe I don't know if it's a pro, but I had experience of depression since my early 20s, and I'm now 32. So it kind of wasn't the hardest part of this disease, is what I'm saying. The
yes,
fatigue was
absolutely.
debilitating, and obviously the loneliness and the being misunderstood. Your work doesn't understand what's going on. Friends and family are like, "Why are you so tired all the time? Just take a nap, just like take a 2-week holiday. You'll get better." And
Only
that's
it was that simple.
you hope it'll do that, but yeah, I think I relate to you a lot where it's okay, this is not depression, this is something else. I feel like there's weights in my body that are just like keeping me in my bed. Why am I sleeping a whole night, waking up, sleeping a whole full day till 5-6 in the evening? I couldn't understand it.
Yeah, and
I think there is yeah.
Sorry, Chris. I just think that also is important to say that for me, well, I had never really heard of post-exertional malaise. And it was only whenever I got in touch with an ME charity in Northern Ireland that they told that the woman who founded it, she was like, "Are you worse after you do something?" And I was like, "Yes." And she said, "But you've got post-exertional malaise, which is one of the defining symptoms of ME. But an awful lot of people with long COVID also suffer with post-exertional malaise." And I think that is really poorly understood as well in the medical profession, in that, and general people, it's like they don't understand that if you rest enough to be able to go out for an hour and they see you out, you look okay because we've got an invisible illness. And then you go home and you're crashed for a week or more. And I think that is the hardest thing to try to explain to people, that, everything we do has a consequence. And unless they're living with you or they don't understand just how awful that is, and I think, again, it's something that society don't even understand. It's like, well, we saw you out the other day. How can that, you looked okay, and how can you tell me that took a week to recover from? It's like, you've no idea how much that takes out of you, And I think I'd never heard of it until the ME charity told me about it. And then I was like, that kind of totally changed how I lived, because I think up until that point, I was still trying to push through. I was still trying to get better, like trying to do a bit more, because that's what we're told. That's what society tells you, keep going, taking a rest is a weakness, or taking a break is a weakness. when actually we like you said about the lead in your body, I feel it's like this lead curtain just comes down and you physically cannot move. And sleep isn't restorative. People don't understand that. Like, because if my husband had a sleep for 2 hours, he'd wake up and feel fantastic. I have a sleep for 2 hours and I feel as worse, as bad as I did before I went to sleep. So it's the most cruel condition, I think, really.
I know. For those listening who haven't heard about the triple therapy, what my doctor specifically, I guess your doctor would have said, it's basically a theory is that the blood vessels are being damaged by the spike protein that's causing knock-on effects to your microclots in your blood. Your mitochondria aren't getting the oxygen and nutrients they need. So I think there's definitely something there with the blood vessel damage that hopefully we'll be learning more, and in the next couple of years. Also, I'm hoping that they'll start to offer that in the UK. I met a girl outside the hospital a few months ago, and she'd flown all the way from Switzerland just to do this treatment with Yaku at the Mediclinic. Yeah, and I just thought, wow, like this is
My
serious.
friend,
Like, why isn't this available overseas?
Yeah, my friend told me about the recent doctor that I saw. She flew from Northern Ireland to South Africa to go to is it Dr. Jacko? Jacko's?
Yaku lab
Jack,
show, yeah.
yeah.
Yaku in Afrikaans is what we'd say. You'd say Jacko or Jaku.
Or yeah, it's probably Jacko. I got it wrong, but yeah, and
Yaku lab show, yeah.
Yeah, but that's how desperate we are over here for treatment. And there's no like the UK aren't really very fast forward with their research and what they allow to be researched. Like the research that they are doing is not really relevant. Like we need someone to do research on microclots. I know the likes of Benita Kane and I think is it Rezia Pretorius? I'm so sorry, I pronounced that wrong.
She's at the Stellenbosch University, correct? That's correct.
Yeah, so she has been trying to do stuff and trying to get papers printed over here for it to move forward, but there just seems to be so many obstacles in the way in the UK before research and before trials can take place. And again, like there's one that was recently put out there about a university is going to try like an immunological drug. And I thought, great, I'm going to try and do that. But Northern Ireland isn't included. And that's not the fault of the university who's doing it. That's the fault of the Northern Ireland Health Board, not taking part in these trials. So I'm at even more, people in Northern Ireland with long COVID are almost at an even worse disadvantage because Northern Ireland also has their own government and own health board. Yeah. So therefore, it's like they're always behind. There's never anything. Oh, it's just so frustrating. And it's like, I don't understand how they can ignore the fact that there are millions of people affected because of COVID.
So I was going to ask, do you guys have the NHS as well in Northern Ireland? Does that cover you as well? Okay.
Yeah.
It's funny to South Africans. We're like, oh, that sounds great. Like it's free healthcare. I want to go move to London. Like it must be great.
No, don't do it.
Yeah, but I totally relate to what you said about having to spend thousands. I've gone into debt basically doing blood tests, blood draws, supplements, vitamin B injections. I even went to an IV bar one day to plug a drip into my arm, and they just pump you with vitamins and whatever cocktail you want to like select from the menu, basically. I've tried so many different things. But sure, it's been an incredible conversation. I just wanted to, in closing, ask what would you say to someone else who's in your position? I mean, you've been dealing with this for 4 years now, before the vaccines were even, available. What would you say to someone to encourage them who's dealing with long COVID or a vaccine injury or any kind of chronic illness? Yeah.
I think there are loads of us. There are lots of us out there, and it is a very isolating condition and illness, any sort of chronic illness, is very isolating. But it's important to reach out to, you know, to the chronic illness community, either via social media. Like, that's how we met. And I know, because I'm so isolated and unable to go out to socialize, social media is your only way of connecting with people. And that's how I've got to know people. So I think it's important to reach out to chronic illness community on social media within reason. And also be kind to yourself. Don't beat yourself up. I know that I would, and I do think you do go through cycles of grief. And sometimes you go through periods where it's okay and life is okay. And then other times you go through periods of where you're angry and you're frustrated, and allow yourself to feel those things, because we are dealing with something that is massively debilitating and life-changing. And it's hard for me at the minute to say this, because I don't feel I'm in a place where I feel a lot of hope. But I do think that we are in a position that we will get some sort of answers, and hopefully maybe not a cure, but even treatments to help ease symptoms, so that you can have I always say, I'm existing at the minute. I don't feel I'm living my life. I'm existing. But I would love it if I got some sort of, hope that there's a treatment that will come along that will give us a window of time in our week or day that we can live a bit, and be able to enjoy a bit of life without the awful consequences that come after, and just to keep going. It's really hard. It's a horrible thing, and I never thought I'd be spending what I think is the prime of my life disabled. And just being disabled isn't a bad thing. I think for me, the issue is the lack of recognition of how serious and how debilitating long COVID is, and how so many people are affected, but yet so many, but yet, like in the UK specifically, for me, we're being dismissed. Life is being made harder for us, because of our government's attitude towards chronic conditions, mental health, and disability. So keep going, keep fighting. There are charities and there is support out there that you can reach out to, and just have a bit of hope that we'll one day be able to all meet up and have a big party.
I totally feel you. Sure. I wanted to ask, like you said, we connected on social media. So if you're feeling lonely, that you're not alone. There are lots of us, although we don't know about everyone. Maybe some people don't use Instagram or Facebook, but they're busy and suffering in
I know.
bed, and I just wanted to ask, what is your Instagram handle, so I can put that in below for people to follow you.
Sure, it's @Bex_log. I'll send it to you.
Perfect. I'm gonna put that in the description for you guys, for those that want to follow Bex on her journey. And just again, thank you so much for being so open and honest with your story, Bex. I will keep you in my thoughts and prayers going forward, and would love to keep in touch and see how you're doing. Yeah. And if you ever come to Cape Town with your hubby and your kids, feel free to get in touch. I'll try show you around.
If you come to Belfast, you give me a shout.
I would love to visit Northern Ireland. I've never been to that side of the UK. I've only been to London, but it sounds amazing. Yeah,
it is a nice place. But thanks so much, Chris, for having me.
Thanks, Bex. Have a great evening. Yeah.
You too.